On today's podcast,
So I took the herbs that she told me about. I passed an unbelievable creature. Like, I have no problem sharing with my patients, with my followers, with you and everyone listening to this, that this was a big part of my health journey. They can hide, they're stealthy. And because they can hide and kind of sit within the body, whether they're in our blood or in our tissues, they're consistently influencing our inflammatory pathways. You could have never traveled, you could have lived in the same small town your entire life, and you could absolutely still be filled with parasites.
if you're a healthcare provider tired of just treating symptoms and ready to dig deeper into the root causes of health issues, the Vibrant Wellness Podcast is for you. With insider tips, expert interviews, and the latest in biotech research, this podcast will take your patient care to the next level.
Hello, and welcome to the Vibrant Wellness Podcast, where we dive deep into the realms of holistic health and transformative medicine. I'm your host, Dr. Emmie Brown, and today we have a truly inspiring guest who is also a colleague and friend of mine, Dr. Ashley DeLuna. Dr. Ashley DeLuna is not just a licensed naturopathic doctor, she's also a yoga instructor and educator with her own wellness podcast, Drop It Like It's Doc, with her most recent episode focused on her beloved dog, Casey, and the health benefits of our canine family members. I'm instantly sold. And I have to say, I noticed that you have a video component built into Spotify, which is my go-to platform. I've never seen that before. That's so cool. And so I just want to throw that out there for listeners. Definitely check out Drop It Like It's Doc, Dr. DeLuna's podcast. Her expertise spans across gut health, mental health, women's health, and environmental medicine, making her truly a versatile healer in the truest sense. In today's episode, we're going to explore Dr. DeLuna's holistic approach to wellness with a focus on GI health and parasites, and her practical tips for living a balanced, vibrant life. So tune in as we explore the gut with the exceptional Dr. Ashley DeLuna. Thank you so much for being here, Dr. DeLuna. How are you doing today?
I'm so good. Thank you so much, Dr. Emmie, for that precious introduction. I I love what I do. I love working with other incredible doctors like you. I love that at one point you taught me in medical school. So, there's just all these layers of connection. Thank you for the love for my podcast for Casey. And I must just throw out there that all of the technological things that you see as far as the video on Spotify and things, that's all due to my producer. So bravo to him.
Amazing.
But I am just so excited to share some things that I love about the body and to talk all about gut health and parasites with you.
Yes, I am thrilled that you're here. And I will say, yeah, one of the most likable and most brilliant colleagues, really, who I've had the pleasure of working with. And so when you decided to come on our podcast, I thought this is going to be great. And we've never really focused on parasites. So in functional medicine, in natural medicine, we talk about it more and more. And when I was in training, we didn't talk about it much outside of standard of care. And even the testing back then was a bit different. So before we get into the nitty gritty, though, I would love to know, why should we care? Because the average person listening might think, I'm healthy, I have a healthy immune system, and the conventional thought is, I don't need treatment, it will resolve on its own if I do contract a parasite, unless I have prolonged symptoms, which I think we're going to get into. So if there is some kind of chronic complex case, we might want to look a little bit deeper. So tell me a little bit about, when do you start to suspect parasites, and why should they really be treated and addressed?
Yeah, really good question. And this is something that even for myself, when I first started this journey, I did not think that they were going to be such a big part of what I would see in my patient population or even what I would be seeing in my world. And I think that when we were both in training, and at this point it's been a while, but it wasn't something that was really talked about. Even environmental medicine, we didn't spend as much time as I think that we should have, just being the holistic practitioners that we are, looking at root cause. And parasites were something that it was kind of alluded to that, if you're in a third world country or if you travel, then you might get a parasite, but you can take a drug that would clear it out. Or if you're feeling better, no big deal.
Mhm.
And I find that that is not the case at all. And I find that parasites, and these can be small parasites, and we'll get into kind of the classification and things like that, or they could be kind of what you would think out of a horror movie, like these big parasites, and they can hide, they're stealthy. And because they can hide and kind of sit within the body, whether they're in our blood or in our tissues, they're consistently influencing our inflammatory pathways. And as functional medicine providers, I'm sure you see in your practice a lot too, that we work with individuals that have seen multiple doctors, for something like bloating or abdominal pain or loose stools. And they go to the doctor, they get the standard workup, and they say, oh, nothing's there. Maybe you have IBS.
Mm-hmm.
And I find that in functional medicine, one of my favorite parts of being involved in this arm of medicine is that we don't really accept that. And we always look for root cause. And I find that behind a lot of chronic gut symptoms, but also even just inflammatory symptoms, mental health symptoms, skin symptoms, at the root cause could be this immune activation, which may or may not be triggered by parasites.
Mm-hmm. Yeah, it makes sense. And we really don't get an explanation why with IBS. It's that umbrella kind of diagnosis of exclusion. I had a personal experience where it was like, well, have you tried low FODMAP? And I said, that's way too restrictive for me. No, thank you. Just like I watched a little bit of that podcast, that your last episode, and you said, no, thank you. This medication, no, thank you. This option, no, thank you. But it's like, there's no explanation why. So of course, with functional medicine, which is kind of what we're talking about very often on this podcast in particular, we want to know why. And I love to know, of course, it's so common. I think that parasites are underrated as far as underreported as far as how common. But what do you see a lot of these patients? They say, I have done some international travel or have lived abroad, or it really is just, people who I've lived in the same spot my whole life. And, then you're actually thinking this could be a parasite, and there's features of that clinical case that make you think that. I'd love to know what those are.
Yeah, absolutely. So I find oftentimes that it is a clinical picture that would then guide me to say, we should look into this. And most of these patients, I would say, I think that we have been told, you will only get parasites if you travel or
Right.
if you're in a third world country. And that comes up all the time. And truly, even just to bring me back to what started me on this journey, or even opening my awareness to that this is a piece of a lot of puzzles, is that I was working with an individual who, in her new patient paperwork, she wrote down all these different things that were going on with her. And one thing that she wrote down was parasites. And it was truly this long, long list. And I'm sure that you have patients like that too, where when you're reading their initial intake, you're like, what is going on here? Is she making this up? Like, where'd she get this? Is she someone that researches online? Did she get this from TikTok? Like, honestly, where did she get this? And then I met an individual. She shared her story with me. She shared pictures with me. She shared what she was doing to clear them with me. And I'm a scientist. I like to experiment, and I am my laboratory subject. So I took the herbs that she told me about. I passed an unbelievable creature. Like, I have no problem sharing with my patients, with my followers, with you and everyone listening to this, that this was a big part of my health journey as well. So of course, you can have a history of international travel. I love traveling. However, you can get parasites in a myriad of ways. One way is undercooked food. So undercooked seafood, undercooked pork, undercooked meat, because these parasites actually live within those tissues. And I'm sure that some of the listeners have maybe seen this pop up before, where you have a scientist who's taking really fine slices of sushi grade tuna or sushi grade salmon and looking at it under a microscope. And you can actually see them. So food is
I just want to go like this.
I love it. That's a freak. And I've had people, reach out to me on social media and stuff. And I think that a lot of people want to assume that it's food all the time, even going back to you saying, the low FODMAPs piece. And I find that a lot of the times it's not food. Of course, in certain autoimmune reactions, or if someone's sensitive to gluten or lactose intolerant, yes, of course, it's the food.
And it's more obvious in those cases, I find too.
Way more
what I mean?
obvious.
Like, take it out for 2 weeks, like even 1 week, and you'll see clinical improvement in a lot of those cases.
Yes. And in the patients where that's not the root, they will go into these bubbles of restriction, which is so detrimental for mental health and body image and the nervous system, and they don't feel better at all. And, I work with a lot of individuals that are plant-based, or I used to even be vegan, and they say to me, I don't eat pork. I don't eat sushi. There's no way I can get parasites. But do you like pets? We all know I love pets. Do your dogs sleep in the bed? Do you kiss them on the mouth or the snout? I mean, I didn't know that that's how you could get a parasite. And I used to kiss them right on their dirty little mouths all the time. You can get them from swimming in water. Some can go right into your skin if you're walking barefoot on a surface that has them in the soil. There is a myriad of ways you can get them, and a lot of them are a fecal oral route. So if you are exposed to something in which they are passing that vector, you will obtain it in your body. So there are so many ways you can get it outside of travel. And in most countries in which this is just known information, in which they don't kind of think that they're too clean or too good to get parasites, because I think that's kind of what a lot of individuals think about the United States, which is comical to me because this is not a healthy country. It's standard of practice that they just, even the students, the kids, they'll go to school and twice a year they go to the school nurse and they take a medication to clear out. Or in a lot of indigenous cultures, they do parasite cleanses a few times a year just as part of their practice. So I really do want to stress to your listeners and viewers that you could have never traveled. You could have lived in the same small town your entire life, and you could absolutely still be filled with parasites.
Right. We're not too good for parasites here in the United States, in other words. Yeah. And that's so interesting. And to think that other countries are thinking about this as routine wellness, prevention, management of well-being. And it's just kind of accepted. We live and breathe on this planet. We walk around barefoot as we should. We have pets as we should for biodiversity, so there's all these wonderful things that come along with diversifying the microbiome with doing these things. But also if there is some kind of complex chronic case, maybe we need to think about parasites a bit more. Okay, what about the moon? Tell me about the moon, please, Dr. DeLuna. Parasites.
I know, I find it so ironic that my last name is Luna, and a lot of what I cover health-wise or what my favorite things to work on are things that are influenced like the moon.
Yeah, it's beautiful.
Like parasites. And so I'm sure you've felt this before, or symptoms have said this, or it's just kind of commonplace that people feel like things get weird around the full moon, right? People turn into werewolves, and yes, we can blame some of these things on hormones and whatnot, because as women, we are cycling with the moon. But independent of that, I always ask my patients, and this is another kind of clinical insight that I have when I'm trying to pick apart, is parasites part of their case? What is the timeline like? Do things flare around the full moon? Or if, they're saying, I can't sleep, this is happening, that is happening. And I say, when is it the worst? And they say around the full moon. I go, maybe parasites. And the reason why is because we have hormones that are shifting continuously based on our environment. And the moonlight, when it is full, it's the most abundant light that we are receiving during that moon cycle. So as that goes into our eyes, it's actually telling our brain to make less melatonin, because we make melatonin when it is dark out. That is why you get tired as the sun goes down, or should, I will say. And when the moon is full, we are making less melatonin, and in turn, we're making more serotonin. We know serotonin as the chemical that makes us feel good. However, serotonin is also a mechanism for parasites to become motile in the body. They use serotonin to move their squiggly wiggly little bodies around. And because of that, because they're the most mobile, they're eating more, your immune system is seeing them and having more of an immune activation going on. That is usually why symptoms get louder around that time of the month. And that's something that I always screen my patients with, because again, this is very, very common. And these symptoms around the full moon, it could be a wide variety. It could be, I clench my jaw around the full moon. I have insomnia around the full moon. I have insane sugar cravings around the full moon. I get yeast infections around the full moon. My eczema breaks out. My acne gets worse. My mental health spirals. I'm anxious. I get really angry. I have, panic attacks. It could be so many things, but the key there is, does it flare around the full moon? But of course, there will be symptoms presenting throughout that whole moon cycle, but usually it's spicier around that time.
It's amplified around the full moon.
Yes, absolutely.
Yeah. I imagine in women with PMS, menstruating people with PMS, with the overlap during the full moon, that can be really difficult to tease out.
Yes, absolutely. And that's where, other pieces of the clinical story come in, and then also lab work and stuff like that I know that we're going to get into. But also, though, let me just say that if there's an overlap of symptoms clinically, but if I even have a little hunch that there could be a parasitic presence, which I get that hunch a lot, I usually still treat my patients with the herbs and the protocols that I do, because again, most cultures are aware that this is something that we need to be doing regularly. And because we don't, because we think that we're too clean or something in this country, which is hilarious, it's something that I find that most people benefit from, irrespective of.
Regardless.
Yes.
Right. And that begs the question too. We'll get into testing and assessment and management because I'm fascinated as far as your approach. And I think there's really an art to it. And every practitioner is probably going to be a bit different depending on the case. But what are you thinking in terms of the identification of the parasites? Like you said, creature. So I think a lot of listeners, practitioners are wondering, are you identifying these things? And at the end of the day, it could be a clinical diagnosis, right? So you're suspecting it. The testing has gotten better, again, so we'll get there. But even if we don't have a finding on a test of a parasite, it can really be a clinical suspicion and diagnosis. And with that said, though, are people sending in these parasites to be identified?
Yes. And let me even go back because I use the word creature. As your listeners can probably tell, I'm very animated. I'm an entertainer in a lot of ways. So creature,
I love it.
That came out of my mouth. But they don't have to be these big, massive creatures, right? They can be, there's a few different classifications of parasites. So for instance, fleas and ticks and mites, those are parasites. They're ectoparasites that feed off of your body. That's not necessarily what we're talking about, but they can be vectors. They can pass a lot of different disease through binding to your body. And even just the word parasite means that these organisms are benefiting from the host. They're not living in peace. They are not living in some sort of benefit with the host. The host's expense is always taken when you speak to a parasite, but there are microscopic parasites, which are typically protozoa. These are small things like giardia, things like malaria, things like cryptosporidium, and Eva histolytica. These are words that maybe some people have heard of, maybe not, but they're microscopic. They're living in the blood. They're living in tissues. So you're not going to see those pass. However, there's also macroscopic parasites, which are things like helminths. And those are typically what people would think about when they think about a worm, right? Like I passed a tapeworm, I passed a pinworm, I passed something large that you are visually seeing. However, you don't always see them. And even if you do have one of those macroscopic helminths, they're not usually shedding in large pieces. They can. And I actually work with a lot of parents and kids who will, you could visually see something like a pinworm around the moon. You'll visually see it. However, while this sounds like a horror story, it's not. It's very subtle, which is why a lot of people don't realize that's what's going on. However, if you're not taking herbs or treatment, of course, you can pass little pieces of parasites. So I've actually had some patients be like, what is this? It's moving and it's a little piece of a tapeworm. And I mean, if you have dogs or cats, you've probably seen this, right? Like, I mean, I'm not a vet, but I learn a lot from animals and you could see them pass. But of course, you could physically take that, send that into a lab, get it analyzed. However, most of the time, I would say that doesn't happen, but you absolutely can do that.
Yeah. And a lot of people are talking about parasites more, and there's pictures being taken and being shown to their healthcare providers. And yeah, I just think it's fascinating and something that we need to destigmatize. And that's really what we're getting at is let's normalize this as other cultures have done and societies have done, just so we can really work towards whole health and wellness. That's really important. And I just want to mention, you mentioned Giardia, Dr. DeLuna, also Entamoeba histolytica, cryptosporidium. So you had those three, and Cyclospora. That's another really common one that we think about as far as outbreaks here in the United States. And that's how this is coming from the American Academy of Family Physicians. That's how they frame it, is like, well, only with outbreaks of contaminated food and water. But again, it seems like it's not just an outbreak that we might read about in the news with a recalled item. It's something that could be more stealthy. So I think it's a really important conversation to have. Yeah. So I just want to throw out those four. Yeah. Because people are going to wonder, you're like, well, what are these parasites? But the helminths aren't talked about enough. And that's where I think it's when you start to use those herbals, right? You start to pull more of those. Is that what you see?
Oh, yeah. And, we'll get to my process and things like that. But I also want to say that if you're taking herbs, you might not physically feel like you see them. However, if you were to break apart your stool, because they're living inside of you, they're not just going to pass alone.
Right.
You will be able to find them and you will see them if they were present and if you killed them and if you passed them. But again, it might be microscopic. You would never see that. But then symptomatically, you would start to see the shift, which would then clinically tell me, hey, you cleared something out of there.
Sure. Yeah, of course. Okay, so let's get to your process. Of course, there's stool testing. And so I want to know, what are you looking for on stool testing if you don't have that identified parasite on the pathogen report? Are
Yeah.
there other signs? Dysbiosis, inflammatory markers? I'd love to know, like, what patterns are you seeing?
Yeah. So the way that I typically approach my one-on-one patient care is that I always start with an initial intake in which we talk about every possible part of them. We talk about their symptoms, we talk about their past medical history, their trauma, their travel, and then a lot of screening questions that could help me kind of gauge what's going on here. From there, I always do blood work before I do a stool test. So I also want to highlight some things that could show up on blood, and then talking about all the amazing things that I see on a gut zoomer, because that's typically the testing that I run when I'm looking at someone's gut. So for the blood work, something that I see a lot of, which anyone who is concerned about hair loss or anyone that is wondering why they can't get their iron up, this is something that I really want you to open your ears to, in that parasites, because again, they are living off of us. They are stealing our food. They are causing inflammatory reactions in the body. And a lot of the times that is in the gut. I find that ferritin is quite low. And ferritin is the storage form of iron. And sometimes, and this is one of the patient stories that I was going to share later, sometimes people will come to me saying, I have this unbelievable hair loss. I don't know where it's coming from. We check their labs. Hormones are looking good. Inflammation's looking good. There's no autoimmune, things like that. And then we look at ferritin, it's incredibly low. That could be a reason for hair loss. So that's one thing that I see a lot of. On the CBC with differential, this is looking at kind of the different armies of your immune system. And I typically find that if someone is, they went somewhere, they're actively sick from that travel, you would notice that their white blood cells, which is their total army, would be elevated against that. But I don't typically see people for acute care. I typically see people for chronic, long-standing complaints, in which then their white blood cells would be on the lower end, or
Yes, that's what we see a lot.
Yeah. Or, below 5 or something like that. So, typically a conventional provider would be like, the immune system's not active. There's nothing going on here. For me, I go, why is the immune system a little bit sleepy? If there's no autoimmune, there's no toxic exposures, things like that, which there still could be. But then we look down at the breakdown of the army, which is the differential piece of the CBC. You'll see that eosinophils are typically elevated. And as I'm sure you do, functional medicine providers usually have much more narrow ranges when they're looking at labs rather than the reference range that is provided by the lab. So I have very narrow ranges in which if someone's eosinophils are 3 or above, I'm wondering, are they having an immune activation to allergies? Of course, if there's someone that is really atopic and they've had allergies their whole life, then yes, of course, it could be from that. But if they're like, no, I don't have allergies, I don't have eczema, I don't have asthma, but their eosinophils are super high, that could tell me parasites are present. Also, basophils, because both of these cells, they are activated by IgE, which is the antibody that would then trigger mast cells to release histamine. So a lot of the reactions that show up with parasites are related to histamine. So I like to see what their IgE levels are, their basophils, their eosinophils, their ferritin, their inflammatory markers. So that's blood work. And then if I do a stool test, and I often do stool tests. However, like I said in the beginning, in these patients, if clinically their symptoms are adding up, if I'm seeing those findings on blood work, we're jumping in treatment. But some individuals come and see me and their gut is the loudest thing. It's loud, screaming at them every day. It's contributing to their daily suffering. They may have had labs done by their provider a couple months ago, and I feel comfortable enough to kind of work with that. And then we go into a stool test. And with the stool test, I love the gut zoomer. I really do. It's really the only stool test that I use. And the reason why I use it is because of the very unique and descriptive view of the gut. Not only the parasite presence, but also just the entire microbiome to see what is going on. But something that you will see if it's present are microscopic parasites. I do see a lot of those show up. However, you can also get a helminth on there. I will say, though, because those are large, and the way that they're typically tested is through their ova, which is egg, and then the physical parasite. And because anyone who's ever done a stool test, it's not a huge sample. And then to look at this under a microscope, it's a little tiny spoon. So you're not going to find a massive creature in that little spoon. You might find an egg. But even if on that test, I don't see a macroscopic parasite, but then they have inflammatory markers elevated. And then I love on your test how it shows fecal eosinophilic protein X, because that is showing that those eosinophils, even if I didn't do a blood test, that they're still active in the gut, which almost always tells me, hey, there's a parasite going on, especially if they don't have, IgE related food allergies, which are pretty darn obvious because you get itchy, swelling, hives, difficult breathing. That is usually something that these patients have known for a long time.
Yeah. So it's kind of that backdoor approach with the blood work and the eosinophil protein X. It's such a nice way of saying, well, there's other signs that we can look for, because we're not going to have a textbook case all the time where everything is lit up. So that's helpful. And also, I'm curious, in your practice, you said if the gut's shouting at you, obviously you're going to think about stool testing, but do you see kind of cases where maybe it is more of this itchy, jaw clenching, mood focused case, and you're still doing stool testing? I'm sure the answer is yes, but I just kind of want to know your thoughts there.
Yes, I do. And, I would go to stool testing if, of course, if the gut is talking to us, which we spoke to, but if I am working on the whole body and if things aren't necessarily shifting in the way that I would expect to, and say that someone has something a little bit more mild, like bloating, that would still then tell me we should take a look at the gut, especially because with things such as the gut, the first few visits with me are really working on the foundation, making sure that you're eating good quality food, that you're in the parasympathetic while you're eating, that you're chewing, that you're enjoying that experience, that you are not chugging water while you're eating, all these things. And if we work on the foundations, if they've done, kind of that foundational protocol, and if the gut is still not clear, even if it's more subtle symptoms like, hey, sometimes I'm constipated, or I haven't had a normal bowel movement in 5 years. I'm sure you have patients like that are like, I don't know, just always a little loose. I thought that was normal. Then
it's normal for them.
Yes.
Yes. But that's why the Bristol stool chart, so important to get really granular with these things. So, okay, got it. So it is always kind of like, well, who has perfect, regular bowel movements every day without, maybe there is something that's flaring during the full moon, like you said, or there is some kind of pattern. So that's helpful. Any other signs and symptoms? You mentioned a good list, but is there anything else popping out that you maybe think about parasites if you ruled out kind of the other stuff that's on your radar?
Yeah. So with parasites, you can see a whole bunch of things. You could see chronic sinus congestion. You can see rashes. So I see a lot of eczema, psoriasis, hives, even an overgrowth of yeast that flares around the full moon. I would consider that to be a piece of the picture, because I'll continue through the list in just a moment, but parasites, I want your listeners to really understand this. They will live in an environment in which they are welcomed. And an environment in which they are welcomed, I could go full energetics and just talk about energetic boundaries, but that's not necessarily what I'm speaking to, which that's very valid though. Absolutely.
Totally. And such an interesting concept and conversation to have another time, which I would love to do that.
I would love to as well. So, oftentimes parasites will take hold in an environment that is helpful for them to take hold and to grow. And that environment is usually one that is toxic. And I started this by telling you about my body and my journey. So that's not a judgmental term of saying toxic. I think that your listeners are well aware of what we are exposed to on a regular basis. But for an individual that has a high burden of heavy metals or has a high burden of mold, that will create a beautiful environment for these parasites to live. So that also then can make the clinical picture a little bit more convoluted or complex, because then you're thinking, hey, is this a mold picture or is this parasites? Because a lot of the symptoms do overlap. Things like brain fog, that's huge. Changes in the mental emotional status. And there's actually studies that have come out over the population in Brazil, in which in Brazil, about 80% of the population has toxoplasmosis antibodies, in which these types of parasites, when they go into the brain, they can make you aggressive. They can make you just not emotionally as stable as you would want to be ideally. So I see mental emotional things show up all the time. Something that I actually shared on my recent podcast, which isn't out yet, is how parasites can change your brain chemistry, making you self-destructive. So you can become suicidal. You can become just really aggressive towards yourself. So that's something that I want to stress to your listeners too, because I think mental health is so important and it's something that's often overlooked. And we're told, hey, take this medication. It's probably a neurotransmitter imbalance, but it's almost always never a neurotransmitter imbalance. But of course, we just spoke to how parasites are influenced by serotonin. So there is that connection there. Other things I see a lot is bloating, like we said, constipation, diarrhea, just any type of abdominal symptom that's just uncomfortable. Feeling like there's almost little pockets of density in your gut that don't necessarily move with bowel movements.
Ooh, interesting.
Right? I see a lot of menstrual changes. I see a whole slew of things, really. Oh, how can I not list this one? An itchy anus.
Right.
That one is so common, and I think people overlook it. I'll have patients at the end of the visit being like, "Oh yeah, I didn't want to say this, but my bucket gets itchy around the full moon." I'm like, "Tell me these things."
That's huge.
Huge.
Right. And you talked about candida too. And the complexity of that. So if there's candida overgrowth in the gut, I mean, that can make us itchy too, on top of parasites.
Yeah.
And
hemorrhoids, so can all these things, right? But
sure.
it's worth checking it out.
Absolutely. Well, especially because they can co-occur. So, and I really appreciate that you spoke to mold in the setting of parasites, because I think there's a lot of practitioners, including myself, who shy away from, like, I don't want to do Lyme, or I don't want to, we want to pick and choose because we want to do what we're passionate about. And I honor and respect that. But in the realm of holistic medicine and root cause medicine, they're layered on top of one another. So we can't really pick and choose. At least having an awareness and being educated on it, knowing when to refer. I think that's so important. So thank you for pointing out that in the setting of these very common things that are oftentimes overlooked, like toxicity and mold, mental health issues that may have been diagnosed or managed a different way, there could be something a bit deeper. So that's huge. Okay, I would love to jump into kind of your management strategy. What do you have in your toolbox, if you will? And if you want to use a case to illustrate that, that would be fantastic. However, you'd love to, share what kind of herbals are you using, and kind of have you done any research in terms of other cultures that, as you said, routinely treat parasites? What are they using?
That's a great question. Truly. So with anyone that I'm working on, I will go into a case because I love this case so much. But first I'll kind of give the overview. So step one, always the foundations of health, because when you're doing something like a parasite cleansing can be hard on the body. And in order to cleanse, your liver has to be ready. The liver is what is metabolizing and clearing out things that should not be in circulation, as are your kidneys, as are your other organs of elimination, like your skin and your lymph and your biliary ducts and channels. So step one with me is always, like I said, we have that my initial visits are 2 hours because I need to know everything about my patient. So we have that visit, we gather the information, and we give them a baseline treatment plan that would fill in the foundations for health. So we're working on nutrition, we're working on their lifestyle, we're working on their hydration, because the truth is, if someone is not pooping every day, or if someone's not hydrated, if someone's not moving their body, if someone is never sweating, doing something like a parasite detox or any detox is going to be quite uncomfortable. So that is always my first step. I like to do a couple weeks for certain patients that have been constipated long-term or that have significant toxic exposures. We might be doing the drainage piece, which is truly just supporting those organs of elimination for a couple months until things start to shift. And then I can tell that clinically they may be ready. And also, because we're timing these things around the full moon, for the most part, the treatments of the anti-parasitics, we usually have some time clinically in which we could kind of work on this foundation before jumping to it, because so many people come and see me and they're like, can we parasite cleanse? And if they're not ready, I don't feel comfortable kind of setting them down that road. So
sure.
as far as working on the drainage piece, I love just the foundations of health. I think that naturopathic medicine does a beautiful job at helping patients and individuals take responsibility for their health and take responsibility for the things that they're doing that are contributing to health, and also the things that are maybe not contributing to health or maybe contributing to suffering. So I always make sure that there's clean water in place, that they're eating plenty of fiber in terms of whole foods, that they're getting enough protein, enough B vitamins, enough minerals. If someone needs help going to the bathroom every day, I love doing herbs for that. I love doing magnesium for that. I love doing coffee enemas for that. I love colonics. There's so many things for that piece.
Yeah.
But as far as the anti-parasitic portion, I love herbs. I love herbs so much because they are broad spectrum. Because conventionally, they typically will treat with a few limited drugs that are usually species specific, but they're not necessarily broad spectrum, in which they're getting the protozoa, they're getting the helminths, they're also treating the other chronic infections that may be living alongside with it. Because a big part of this treatment is breaking down biofilms, because biofilms, I describe it this way to my patients and my students, is that they're kind of like boogers. They're like these gooey communities that things can hide in. So things that
Sticks together everything in there.
Together, and it's really like a booger. And things like mold and heavy metals and viruses and bacteria and parasites live in these ecosystems together, and it's because they're walling themselves off from their immune system. They are so incredibly smart. So while we're working on drainage, we're also starting to gently work on the biofilms, just so that the immune system can start to see them and start to clear them. And then at the full moon, we do herbs. So is it okay if I talk about specific products on here or no?
Sure. Yeah.
Okay.
Whatever you like.
Okay, great. You never know. So
Sure.
I really like biocidin as kind of a baseline broad spectrum antimicrobial. Technically, biocidin is antiparasitic. However, I will say that I've not had the benefits with using that alone that I have with Cellcore's parasite supplements. They don't pay me to talk about them. I just know from personal experience and clinical experience how transformative they are. These are different products that are all herbs. So going back to the biocidin, I really like that because it's quite a few different potent botanical extracts that can help to kind of strengthen the immune system, break down the biofilms while still being anti-parasitic in nature. So I set them up on that. But then around the full moon, we do a full-blown parasite cleanse, which involves 4 different supplements. The first is a ground up plant, which is called Mimosa pudica, which is actually the pitcher plant. So it is a plant that a lot of individuals have seen before and maybe played with. It's that plant that when you brush your finger over it, the leaves will slowly close around you. That is one that is used in indigenous cultures all around the world. That plant alone, if I was to recommend one plant for detoxing out parasites, it would be Mimosa pudica. It is strongly anti-parasitic, but it also creates almost this goo in the gut to scrape the lining, to clear out those biofilms, to clean out the other infections, and also to physically move the parasites out. So that is amazing. There's also a lot of Ayurvedic herbs, which, I love Ayurveda, and that's a style of medicine that has been around for centuries, and they have this kind of embedded in their culture and in their practice, these anti-parasitic herbs, and they do amazing things with the gut overall. So another product in that kit, it's called Para 2, but really it's a combination of quite a few different herbal botanicals that are working on the immune system, anti-parasitic, but also toning the gut, helping the gut clear things out. I find that a lot of people don't feel well when they parasite cleanse, especially if they didn't do that drainage piece. But sometimes it's because when you are killing something, you are releasing their toxins in the body and into your bloodstream. So having something like a binder, which is truly like a magnet, will just bind those toxins and clear them out. But I think the strongest part of that kit is Para 3, which has a few herbs in it. It is very strong. It is a tincture. It has things like thyme. I think there's some oregano in there, basil. So these are herbs that you've probably heard about. So it's not like you need to get a fancy kit. You could do this with food. You could do this with other companies, I'm sure, have incredible blends, but I have never seen the results like I've seen with this product line. So I am sold on it.
And what do you mean by that? At that point, when they're on the para 3,
Yeah,
can you elaborate, Dr. DeLuna?
sure. So, my own history, and I'm sure that you have a similar experience and our colleagues too. The universe gives us things on our health path that we then learn from, grow from, become very passionate about, and then want to share with our patients. And for me, little did I know that I was raised in a moldy house. Little did I know that I was going to raise a moldy school, a moldy apartment, a moldy condo, like just mold, 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 mold. My gut issue was always going on in the background. Mental health was a thing. Skin was a thing, blah, 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 blah. So throughout my medical school journey, I did a lot with chronic infections. I was detoxing for years in medical school, but environmental toxins, stress, all that went into it. So I had tried a lot of different things for detox. I had tried a lot of different treatments, diets, cleanses, herbal treatments. Never have I ever felt what I felt in my body or had a shift in my physical health like I did with the Cell Core para supplements. And I think it's because they are so specific against parasites. And again, I don't work for this company, but they have developed this certain technology that allows the herbs to penetrate deeper in the body. And I think that is why it's so powerful. And also, when I was taking these other cleansing herbs, I didn't pass from my body what I have passed with those products. And so not only physically did I feel it, I visually saw it. And my patients, the changes that they have, it's also undeniable. And I haven't really seen that with any other products before.
Yeah, and it's the proof is in the pudding, if you will, if you're looking at it.
And
Yeah, no pun intended. So, and I wonder, like, you probably have patients coming in with pictures, right? Who are
I tell them, I'm like, this is going to be an experience for you. When I did it with one of my best friends. Every morning we would send each other pictures. I'm like, I need you to know that you can send me photos, but also I love think you were like this. We're trying to break the stigma, things that are taboo.
Yes.
That's my specialty. Talking about things that other people don't talk about because we are all human. We all poop. We all have sex. We menstruate. Like these are things that we should be able to talk about. So I want my patients to know I will emotionally support you. Please send me this photo.
Yeah, good. It's a safe space with Dr. DeLuna. Everyone listening.
It is.
We can talk about parasites and we can get through it together. Gosh, I love that you gave us so many specific pearls, and you talked not only in terms of the laboratory findings, but the management. I think that's hugely helpful. Thank you so much. I'm going to wrap it up here because we've unpacked so much already, and I think we could keep going. And maybe I'd love to have you back because you do so much in your practice. And your body positivity message alone, I think you're such a pioneer there. And I would love to kind of dive into that and how it affects all aspects of health. And with that, from your website, I loved this. I just want to leave our listeners with this before I jump into our rapid fire questions, if you'll entertain me with this. True healing is about self-exploration and self-love while supporting the body's natural healing mechanisms. That's on your website, and I just really appreciated that sentiment because we talk a lot about root cause and the why, but it also, I think that part of that is understanding ourselves and really spending time on self-care. And what does that mean to be in tune with our bodies? Because it can be, especially with parasites, this can be a very maybe scary, very maybe shocking experience for a lot of people. We might not want to look, a lot of people don't want to look at that side of themselves. So the self-love component is something that I really value. So I wanted to throw that out there. And with that said, what are some of your favorite ways to practice self-love? And in terms of just, like top 3 things that you do maybe on a daily basis or a weekly basis to practice self-love.
Oh, I love this question. And also thank you for sharing that. It means so much to me. I mean, you never know the impression that you give off. So I love that body positivity rings true. And, even when speaking of the parasites, collectively, there's a lot of shadows that we all have that we don't want to look at, kind of the ugly or dark parts of our own consciousness. And that's just a human label that we've put on them, right? Like there's good or bad, light or dark. And we all need to look at these parts of ourselves because they deserve love and they deserve to be seen and to be heard.
They
That's the thing.
exist.
Practice self-love. I let myself feel everything that I need to feel. I am a safe space for myself. So if I need to journal, I'll journal. If I need to cry, I will cry. If I need to call a best friend and vent about something that's upsetting me, I will ask them first if it's okay, and then I will do that. But the biggest piece there, I think, would be the way that you talk to yourself. And even going back to kind of the parasite mindset and the energy of it, it's self destruction, it's lack of boundaries. And again, parasites were a big part of my journey. So I had to really get real with myself about how I talk to myself. And now, one of the things that I like to practice is inner child work, is when I hear myself getting evil with myself or even talking to myself in a tone that's not well. It could be something as simple as I'm so stupid or why would I do that? Just this tone of negative
Self-doubt.
self-doubt, self-judgment.
Yeah.
I go, sweet baby Ashley, you didn't know better. Or, baby Ashley, it's okay. I just talk to her, do with her the same way I would to a best friend. So that is one way that I practice self-love. Another way that I practice self-love is making sure that every single day I am doing something for me. And this is something that I started back in medical school because I will never forget that it was really imprinted on me that the way that you show up to this program is how you're going to show up to the rest of your life, because you're going to start your practice, you're going to be busy. And if you don't start these things now, it's never going to happen. So people would think I was crazy, but I would go to a yoga class every single day in medical school because I needed to for my mental health. And I carried that forward because I love what I do and I could work 24/7 if I want to, but that's self-destructive to myself. So every single day, I'll either go to a yoga class, a dance class, take my dogs to the park, look at the ocean, something that is purely for me and only me, that is not serving anyone else. So that's two. And something else that I do for self-love is just feed myself really good food. And this is something that was said on my podcast too from Dr. Sarah, which is staying with me, that has stayed with a lot of my listeners, and that I feed myself both, health conscious foods, but also soul foods, because I deserve soul foods. My nervous system deserves them. My body needs to know that it is safe and it is worthy of eating something like bacon, which, is ironic because this whole conversation is talking about parasites and people listening might be like, oh, I can't eat sushi. I can't eat bacon. I have to get rid of my dog. That's not doing that, but giving myself whatever I want and trusting that I am healthy and that I deserve it. So I could go on and on about self-love. It's one of my favorite things to talk about, but those are just some practical things that people can do.
I had a feeling that would just open up a little bit of a conversation there, at least a little bit of a conversation. So I wanted to sprinkle that in there because I can sense the passion and I so appreciate it and find it inspiring. And what you said at the end there, it's like, you don't have to get rid of your dog or bacon necessarily, but normalize that you can increase the risk of these things by enjoying, but also just being mindful and saying, well, maybe we do need to do an annual cleanse.
Yes.
So that you can enjoy these things, and because it's all a part of life.
Yeah.
So it's like we don't have to pick and choose, and we don't have to shame or demonize these things. So I love that. And that was kind of like a mini rapid fire question, but just three really quick ones to get to know you a little bit more personally, Dr. DeLuna. Favorite way to spend a weeknight evening? And I say weeknight evening because, our weeks are jam packed, but anything on a weeknight eevening that you like to do to kind of wind down, anything that you haven't mentioned maybe yet?
Yeah. So I am spoiled in that I spoil myself. And I bought myself an infrared sauna. It is one of my favorite ways to spend the evening. Just melt in there, meditate, and then for bed. So that's one of my favorite things to do. You also can't, you almost can't beat a good cup of tea. I love tea.
Oh, I love that. Okay, yes. I've been loving Ticino. Have you tried Ticino? It is a herbal tea. And it looks like coffee, and it's a good product. It's got that bitter kind of thing with the coffee, but no caffeine. So just throwing that out there. That's a good one too. Good to wind down with. Yeah. All right. What is one bucket list item of yours?
Bucket list. I need to go to Italy. I must. It's on the bucket list. It's screaming at me. Italy and Sardinia,
Yes. Well, I wish that for you sooner than later. I know you'll get there. Okay. Last one. If you could dine with anyone alive or deceased, who would it be and why?
If I could dine with anyone alive or deceased, this is such a good question. I'm silly. I mean, literally, the first that came to mind was Adam Sandler. I can't believe that, but I have no filter, and that's the first person I thought of, and it's because he's hilarious. He's a Jew from New York, which I am as well. I think we would be best friends. I love having entertaining humans in my life, and I think that I would just integrate myself fully into his family. So
that resonates with me. That's very, yes. I can, at this point, he's kind of a legend. I mean, he's a comedic legend at this point. And dining should be fun. So I can imagine dining with Adam Sandler would be loads of fun. Okay, with that, I love ending on that note, fun and light. Before we say goodbye, Dr. DeLuna, where can listeners find you? Your social media, your website, your podcast, anything you want to share, any trainings you have upcoming, whatever you want to throw out there, where can people find you?
Thank you so much for this opportunity and to be able to share a little bit about what I love. I love so many aspects of health, but this is definitely something that I'm passionate about sharing. So just grateful to have this opportunity. And if anyone wants to connect with me, my name is Dr. DeLuna. My website is just Dr. DeLuna, either Dr. DeLuna or Dr. the full word DeLuna. On social media, that is my tag. It is Dr. the full word DeLuna. My podcast is Drop It Like It's Doc, which you can find on Instagram. You can find on YouTube, on Spotify, anywhere that there are podcasts posted, you will find it. As far as things that you can work with me on and things that you can look out for, I have a mold course that's coming out next month, which is going to be just something that I wish that I had when I was living in a moldy environment and detoxing out. I also have different workbooks and things on my website. So I would head over there, but feel free to shoot me a message on Instagram if you want to connect and we can chat about all the things that I love.
Fantastic. And to clarify, Dr. DeLuna, the mold course, it sounds like it's probably geared towards patients, but probably also helpful for practitioners, I imagine.
Oh, that's fun. I mean, yes, I think so. Be gathering all of the information that I used and that I use in my practice. So absolutely, yeah, I think that there would be tremendous benefit in someone who wanted to learn more about that.
Beautiful. Well, thank you so much for joining us today, Dr. DeLuna. It's been a pleasure. We've learned so much. It's been a joy having you on. I hope to see you again. And for our listeners out there, stay vibrant. Until next time.
Woo. Thank you so much. Appreciate it. And I love Vibrant. So thanks for having me.
You're so welcome.
Thank you so much for being here today. Don't forget to leave us a review and subscribe so we can continue to pay it forward together. And remember, the key to longevity is knowledge. Keep learning, growing, and tuning in to the Vibrant Wellness podcast to discover the latest insights and strategies for optimal health. Join us again next week. Just a reminder, this podcast is for educational and informational purposes and is not a substitute for professional medical advice, diagnosis, or treatment. The views expressed by guest and host are their own and do not necessarily reflect the official policy of Vibrant Wellness. As always, consult your healthcare provider before applying any recommendations that you heard here today.